Hey everybody, welcome back to a Therapy Thursday with Dr. Peter, myself, Elaine, and our anatomy friend. So we want to dive in a little bit deeper to toes in or toes out when it comes to squatting, deep squatting. I'm a big fan of toes straight, and so is Dr. Peter. But we also find that there's value sometimes bringing those toes out. And today we're going to explain how that works. To start off, we're going to kind of give you a little anatomy chain lesson here. If you take a look, we've got our app in motion here showing hip flexion. So there's quite a few muscles that are engaged in hip flexion. We're not really worried about isolating those muscles, but what we are trying to show you here is that there's a concert of muscles in hip flexion which occurs during squatting. Now, this as well is driven by the position of the foot. So as we'll come up here into flexion, I'll pause, and you notice that here we have the big toe in line with the shin, in line with the knee, in line with the hip. Now this is just a digital human, and it's not dealing with true loads, true forces. So when we are dealing with loads and forces in real life, that's where we have to understand the value of positioning our body and the angles of the weights on our skeletal system. So that being said, Dr. Peter, let's talk about this. Toes in, toes out.
For me, I think toes in, toes out comes down to anatomy. What's your hip doing? What's your ankle doing? You know, it's great to have the toes in neutral, straight forward if you can, but if you don't have the hip mobility to keep your toes straight ahead, or if you have restricted ankle mobility, typically in dorsiflexion where the ankle has to bend,
right,
then you have to have some degree of toe in, toe out.
And that's what we find is the biggest issue, is that when people don't have adequate ankle flexion, meaning they can get the toe towards the shin, they have to find space somewhere.
Yes, and there you can compensate a little bit by toeing out. And so first and foremost, you know, when you look at somebody's position, I will look at their hip mobility and make sure that they have ample flexion.
Let's talk about some of those tests that you do. So if I walked in and I said, hey, I'm having a hard time getting to a deep squat, what would you do to me?
I would have you first look at your squat. So I like overhead, so I kind of bring the torso into it, and just, I won't give them any cues. I just say squat all the way down and see how you feel. And I will then look at some of the faults.
And what are you looking for? So if I go into a squat and you see...
I look at a couple things there. We see obviously with you, knees caving in. I'm going to look and see if the heel stays on the ground. I'm going to see if you can get your thighs past parallel. Yeah, so the heels are coming up. And I'm looking at how much torso forward movement you have.
So I'm going to give you a real squat. I'm going to do, this is my best.
Okay.
Raw dog. Show me what you think.
All right. I see, you know, a little buttering at the bottom, but otherwise I see no issues with that squat at all. I mean, it's good movement, your heels stay down, your feet aren't moving. So you see that a lot as well. People are moving their feet. And when they move their feet,
when you say moving the feet, when they come down,
yeah, they kind of wiggle with their feet, so they don't grab the floor with the feet. That's an instability that can be an issue, because then something else has got to compensate for that. Now you're doing that under load, you're running risk of injury.
So let's apply when toes out could have value, right? Yep. So let's say I come in and I try to show you my squat. We do the overhead squat assessment, and I've got my feet pointed straight, and you see me do this.
Yes.
Right.
So now you're very hip dominant, right? You're bringing your hips way too far back. You're not bringing your knees forward. It's important to get the knees forward as well. And the knees got to be tracking over the toes.
Right.
And so you want the knees to go out a little bit, even if the toes are somewhat straight.
So in that situation, if I don't have a flexible calf, meaning that I can't get my knee forward so my hips go back and I round out, if I point my toes out slightly, I might be able to find a little bit more space and get into that spot. Is that what you're saying?
Absolutely. And so if the toes out allow you now to squat deeper and you're not having any symptoms anywhere else, then I think toe out is the way for you to go. And that's why there should be no rule. Not everybody needs to squat the same way. Your hips are different than mine. Your ankle are different than mine. Your stability may be different. And so I'll look for, hey, can you do it straight? And if not, you know, what's not allowing for that to go? And then you can start treating and working on those mobility restrictions.
And that's the part I love.
Yeah. But in the meantime, you can toe out a little bit. Keep working on, hey, I want to gain more mobility in my hip. I want to gain more mobility in my ankle.
Right.
And then once you achieve that mobility, now see if you can straighten your toes out a little bit more.
And see, and this is a really key element to the conversation, y'all. When you point your toes out to get into a proper position for a squat, you know, obviously unloaded, there's a lot of wiggle room there, right? But if we want to be able to be powerful athletes, right? If you look at the best athletes in the world, toes are straight. So if I'm going to point toes out to allow me to at least get into some decent positions as I'm moving, what he highlighted there was most important is that that's okay in the event that we're not experiencing any other up-chain correlations, but also that we don't just resort on that as is how we squat, but we spend time mobilizing so that we can try to get a straighter squat over time. Now, once again, people have different hip girdles, people have different angles to their shins. My business partner, Jose, he actually has a slight curve of his tibia. So for him to point both feet straight ahead, that means one knee will track straight and the other one wants to come in. So please, everybody is completely different.
Yep.
But you've got to figure out what's best for you. So what are some of the tests that somebody can do for themselves to figure out where they should be, how far their toes should go in or out?
Yep.
Let's talk about that for a minute.
Easy test you can do, at least look at the dorsiflexion of the ankle. So I'll have
Okay.
him in half kneeling, ideally somewhere near a wall. Put the foot about a hand away from the wall. So go ahead and kneel down for me.
About a foot away?
About a hand away. So here, and just bring your toes up to my hand. Good.
Barefoot
Now,
or am I okay with my shoes?
no, you're just okay with the shoes. Ideally barefoot if you can. And now bring your knee towards the wall and see if you can bring your knees and touch the wall. If you can, you've got ample dorsiflexion as long as there's no
My
heel lift
heel
happening.
kind of comes up a little
Yeah,
bit.
so there's a little bit of restriction there.
And what about the other hip? Should
I
go
don't care
straight back?
what's going on with the other hip.
As long
We're
as I
really just
keep this
looking
down,
at this ankle.
try to
right
get that
there.
forward.
Absolutely.
Okay.
And you compare one side to the other. And
Okay.
again, ideally barefoot would be a little bit better
Yeah, let's try that out.
because it's easier to see if the heel comes up.
I'm a big fan of barefoot. Okay.
So about a hand width away from the wall. That way you're always measuring the same thing. And
Okay.
now see if you can drive your knee towards the wall. There you go. And you can see a little bit of heel lift here.
A little bit.
But overall, really good dorsiflexion. Combined with what we saw in your overhead squat, nothing to worry about.
Okay. Let's try that one again.
Now, if you see a great difference right to left, then you know, hey, we need to work on those issues and try to get them at least fairly similar, one side versus the other.
Okay.
My right ankle is pretty frozen from previous ankle injuries.
Gotcha.
So I don't have
That's
the
why you do
dorsiflexion, and I can try forever. It's not going to happen. It's been 40 years. So I wear a little bit of lift in my shoes.
Gotcha.
Because that way I can squat deeper without having to do a whole lot of compensation,
Okay.
with other movements.
So
And
question then, if I go down here and I notice that I can't quite get my knee forward,
Yep.
okay? Now, obviously we could spend time talking about how to mobilize the calf or posterior chain, but if that's another conversation, what about today? What can I do walking away from this conversation knowing that if I cannot get my knee forward, but I still want to be able to get some squats in my workout, what would you recommend?
Well, I would recommend that you start stretching this on a regular basis. The evaluation is the treatment. So you
I
basically
love
start repeating doing that, especially if you feel the pinch in the front, because that indicates that it's a joint restriction. If you
Interesting.
feel a lot more pulling in the back, it's more of a muscular restriction, and so stretching may be more
If
of
you
an
feel
answer
it in
for
the
you.
front, what do you do?
Well, if you do it in front, you're going to do exactly what you just tested, and you're going to repeatedly go forward, and you can place a little bit of an angle that you go more in, you can go more out, and so work the knee into that direction. You can do it with a kettlebell for a little bit of overpressure,
Okay.
and so you can do this repeatedly. You can do this at home throughout the day. I mean, if you're going to do this, it works when you do it regularly,
You know what
3-4
I
times
love?
a day.
Not only doing it regularly, but the answer was focus on mobilizing.
Yes, absolutely.
Got to mobilize.
You have to mobilize, and then in the meantime, if you want to squat and toe out will allow you to do it safely,
Get a little bit more sit.
then that's okay for now.
Now,
And
what would be okay? I mean, how far out can my toes go? Before it's deemed crazy.
well, if we talk about the squat, that would be crazy, excessive toe out like that. But if you talk about a sumo deadlift, then it's not crazy at all. And you
Right.
can be that wide, right? And so for the squat, that's a little too wide. And I'd say, 10, 15 degrees is a pretty normal way to go. But I
Somewhere's
would,
in this range.
if people are way excessive, then I'll start looking at the hip and say, okay, what's going on with the hip? Is there something else that drives that? And then is there a need to go all the way down? Maybe your safe answer is to do box squats for now, work on some of those issues, because if the only way you can squat is this way, obviously there's a lot of restrictions up chain that we'd have to resolve first. Start with a partial squat, still get a great workout, work on those mobility issues, and then progressively go deeper and deeper.
Great
Going deeper
advice,
is not
Coach.
always the answer.
I love this advice.
Thank
Good
you.
stuff.